What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my Neuroanatomy playlist. In previous videos, we talked about the olfactory nerve, we talked about the optic nerve, the visual pathway, and the defects that can happen in the visual pathway. Then we talked about the third cranial nerve, which is the oculomotor, the fourth cranial nerve, which is the trochlear. We call it trochlear because it's related to the trochlea. As for today, it's time to dig deeper into the trigeminal nerve. Trigeminal nerve is the fifth cranial nerve, so Roman numeral 5. Why call it trigeminal? Because it has three branches. We have V1, ophthalmic nerve, V2, maxillary nerve, and V3, mandibular nerve. Is the trigeminal nerve sensory, motor, or both? Answer, it is both. V1, purely sensory. V2, purely sensory. V3, sensory and motor. Motor for how many muscles? 8 muscles. 4 muscles of mastication and 4 muscles of no mastication. Please click the like button, click the subscribe button, and let's get started. For more videos like this one, check out my anatomy playlist. If you just want neuroanatomy, I have a separate playlist for that. Quick review, the olfactory nerve is the first cranial nerve. It is special sensory afferent for olfaction or smell. Optic nerve, also special sensory afferent for vision. Oculomotor is motor. Is it motor somatic or motor autonomic? The answer is both. So it's general somatic efferent as well as general visceral efferent. As for the trochlear, general somatic efferent. It's purely motor. Remember your line in the sand. In front is motor, behind is sensory. And this applies to the brain and spinal cord. Interior, motor. Posterior is sensory. The brain and spinal cord are central nervous system. Anything else, peripheral nervous system. So your cranial nerves and spinal nerves are peripheral nervous system, which means the trigeminal nerve is part of the peripheral nervous system. What is the structural unit of the nervous system? It's the neuron, which has a soma or cell body and the axon. A collection of somas in the CNS is called a nucleus. A collection of somas in the PNS is called a ganglion. A collection of axons in the CNS is a tract, and in the PNS it's a nerve. Today you will learn that the trigeminal nerve has a nucleus, which is a collection of somas inside the brainstem. The trigeminal nerve does not have just one nucleus, it has 4 nuclei. Then we have a trigeminal ganglion, which is a collection of somas or cell body in the peripheral nervous system, outside of the brain itself. Then the trigeminal nerve is called the nerve once it exits the central nervous system, and we refer to the axons of the peripheral nervous system as the trigeminal nerve. Remember that your nervous system, all of it, came from the ectoderm. The ectoderm divides into neuroectoderm for your nervous system and surface ectoderm for epidermis of the skin, hair, nail, etc. The neuroectoderm is divided into neural tube and neural crest. Neural tube will give us the CNS and neural crest will give us the PNS. What's the definition of a ganglion? A collection of somas in the PNS. That's why all the ganglia come from the neural crest, just like the rest of the peripheral nervous system. So today we will talk about the trigeminal ganglion. It comes from the neural crest. Is the trigeminal nerve sensory or motor? It's both. It carries sensation from your face and it gives motor nerve supply to 8 muscles, 4 muscles of mastication and 4 muscles of no mastication. What are the 4 muscles of mastication? Temporalis, masseter, medial pterygoid, lateral pterygoid. And the 4 muscles of no mastications include 2 tensors and 2 others. Tensor veli palatini, tensor tympani, mylohyoid, and anterior belly of digastric. Recall that cranial nerves 1 and 2 come out of the forebrain, 3 and 4 from the midbrain, 5, 6, 7, and 8 from the pons, 9, 10, 11, and 12 from the medulla. So cranial nerve 5, which is trigeminal, comes out of the pons. You can download these doozy handwritten notes on my website, medicosisperfectionalis.com. I help you understand and pass exams. But which part of the pons? Well, since it's not purely motor, since it has motor and sensory, therefore it's not gonna emerge from the anterior medial or anteromedial aspect of the pons. Instead, it will be more anterolateral. By the way, trigeminal nerve is the thickest cranial nerve, as thick as my brain during a calculus class. Is the trigeminal nerve somatic or autonomic? It's only somatic. Is it somatic motor or somatic sensory? The answer is both. It is sensory, so general somatic afferent. It is motor, and it supplies the branchial or pharyngeal arches, so it is branchial efferent. So what are these branchial or pharyngeal arches? Well, I have a separate video on this topic. You can find it in my embryology playlist, but let's review it quickly. Remember that you had endoderm, mesoderm, and ectoderm. You see the pharyngeal arches? These are mesoderm. You can call them pharyngeal or branchial. So pharyngeal arches, mesoderm. How about the pharyngeal pouches? These are endoderm. As for the pharyngeal grooves or clefts, ectoderm. On the inside, endo. On the outside, ecto. In the middle, meso. I've told you before that the word meso means middle, as in midbrain. Mesencephalon. So let's focus on the pharyngeal arches, also known as the branchial arches. What do branchial arches do? They give us bones, muscles, vessels, tendons, ligaments, etc. How many pharyngeal arches do we have? We used to have 6, but 5 went to hell. It left the chat. So now you have 5 on the right side and 5 on the left side. The first, second, third, fourth, and sixth pharyngeal arches. How about the second? Well, just below the mandible. Third, same thing. As for the fourth, thyroid cartilage, part of the larynx. Any other remaining cartilage of the larynx is going to be the sixth pharyngeal arch. Each one of these pharyngeal arches requires a nerve supply and an arterial supply. What's the name of the nerve that supplies the first pharyngeal arch? Welcome to the trigeminal nerve. Which part? Which branch? The mandibular nerve, or V3. What will the first pharyngeal arch give rise to? Number 1, the first 2 bony ossicles of the ear. The mandible, stuff related to the mandible like the sphenomandibular ligament. I need the mandible for mastication. So the 4 muscles of mastication are also derivatives of the first pharyngeal arch. What are they again? Temporalis masseter, medial pterygoid, lateral pterygoid. Then 4 muscles of no mastication, including 2 tensors, tensor palatii and tensor tympani, mylohyoid, and anterior belly of digastric. Who supplies the first pharyngeal arch again? This is the mandibular nerve, which comes from the trigeminal nerve. The pharyngeal arches are mesoderm. Who's going to supply them? A nerve from the ectoderm. The first pharyngeal arch is supplied by V3. As for the second, well, V3 is a big nerve, right? Yeah, and I need a motor nerve, so it's going to be motor and big. How about cranial nerve 6, the abducens? It is motor, but it's very small, so skip it. Facial, oh, motor and huge, so it can supply the second arch. Then after 7, you go to 8. It is sensory, so ignore it. After 8 comes 9. Oh, that's a big nerve. It has motor fibers, so it can supply the following arch, which is the third arch. After 9, what do we have? We have 10, which is a huge nerve that has motor fibers. 10 is so big that it can supply the fourth and the sixth pharyngeal arches. Since these nerves, mandibular, facial, glossopharyngeal, and vagus, supply the branchial arches, we call them branchial. And since they have motor fibers, we call them branchial efferent. So what are the only branchial efferents among the cranial nerves? V3, 7, 9, and 10. That's it. Let's review the first 4 cranial nerves, then let's talk about the 5th cranial nerve. Olfactory nerve, cranial nerve 1, it starts from between the olfactory mucosal cells in the roof of my nose. Then I have bipolar neurons. Then the mitral cell of the olfactory bulb, and then olfactory tract, and then the telencephalon of the forebrain. So special sensory cells, then a nerve, then a bulb, then a tract, then forebrain. The same exact thing happens to the optic nerve. Special sensory cells, the ganglion cells of the retina, then a nerve, optic nerve, give me a bulb, optic chiasm, give me a tract, optic tract, give me a piece of the forebrain, diencephalon this time, not telencephalon. Recall that cranial nerves 1 and 2 come from the forebrain. Next, cranial nerve 3, not forebrain but midbrain this time, starting with 2 nuclei. One is somatic motor, the other is autonomic motor. And here is cranial nerve 3, leaving lateral wall of the cavernous sinus into the superior orbital fissure and the tendinous ring, divides into superior division and inferior division, collectively supplying the levator palpebrae superioris, including its superior tarsal muscle, with some sympathetic fibers that I got from the plexus around the ophthalmic artery and internal carotid artery, superior rectus muscle, inferior rectus muscle, inferior oblique, and medial rectus. But the oculomotor does not supply the superior oblique, and it does not supply the lateral rectus. How about the parasympathetic branch? Oh, look at this ciliary ganglion. So I have preganglionic fibers and the postganglionic fibers. The postganglionic fibers are short, classic parasympathetic behavior, and they are called short ciliary nerves. These are parasympathetic fibers that will supply the ciliaris muscle or ciliary muscle and the constrictor pupillae or sphincter pupillae muscle to accommodate my lens and to constrict my pupil. Fourth cranial nerve is the trochlear nerve, purely somatic motor. It leaves the trochlear motor nucleus. It's the only cranial nerve that goes behind. It emerges from the posterior aspect of your brain. Every other cranial nerve emerges from the anterior aspect. Then it turns around like this. It goes to the lateral wall of the cavernous sinus, yet again, enters into the superior orbital fissure, but outside of the common tendinous ring. It will supply one muscle only, which is the superior oblique muscle, to depress my eyeball, help me look laterally, and externally rotate the eyeball slightly. Now let's talk about the trigeminal nerve. Trigeminal nerve is for the sensations of my face, how I feel the feather touching my face. But how about moving my facial muscles? That's the facial nerve or cranial nerve 7, which will be discussed in its own separate video in this neuroanatomy playlist. Sensations of my face, trigeminal nerve. Here is the ophthalmic branch. Look at this. This is very important, and it's important to know that V1 involves the eye and the tip of the nose, and this is huge, as we'll discuss later when we talk about the clinical anatomy. How about the maxillary nerve? It supplies this area, upper jaw. How about the lower jaw? This is the mandibular nerve. So basically the trigeminal nerve is supplying most of my face, except the area over the parotid gland, which is supplied by the greater auricular nerve. Why do you call it auricular? Because this is your auricle, ear. Where did the great auricular nerve come from? From the anterior rami of the second and third cervical nerves. And these are spinal nerves and not cranial nerves. The back of the scalp is not supplied by the trigeminal nerve. When it starts in the brainstem, we start with a nucleus, but this time we do not have one nucleus, we have 4 different nuclei of the trigeminal nerve. What are these nuclei? We have a mesencephalic nucleus. What does the word mesencephalic mean? Oh, mesencephalon is the midbrain. Thank you so much. So it's related to the midbrain. Then we have main sensory nucleus and main motor nucleus of the trigeminal nerve. Both of them are in the pons. Last, we have a spinal nucleus. Why spinal? Because it's in the medulla and extends to the spinal cord. What's the function of the trigeminal nerve again? Sensation of my face. But don't forget that V3 gives motor supply to 8 muscles, 4 muscles of mastication and 4 muscles of no mastication. Where do these motor fibers come from? They originated from the motor nucleus, which is in the pons. Look at this. Here's the motor nucleus, which gives us the motor root of the trigeminal nerve, which will only join with V3. It will not join forces with V1 or V2. Only V3, because only V3 is motor. V1 and V2 are purely sensory and not motor. So V1, I am purely sensory. V2, purely sensory. V3, sensory and motor. Motor to whom? To 8 muscles. So now I know where the motor fibers originated from the motor nucleus of trigeminal nerve or trigeminal motor nucleus. But where did the sensory fibers come from? Well, it depends on what kind of sensation you're talking about. If you're talking about pain and temperature sensation in your face, pain and temperature reminds me of what? Of spinothalamic tract. So, spinal nucleus. Bingo. But if you're talking about general sensation, meaning touch, this is the main sensory nucleus of the trigeminal nerve. Some people call it main sensory, others call it principal sensory, others call it just trigeminal sensory. But what if the sensation is proprioception? What does that remind you of? Oh, posterior column, medial lemniscus system. Medial lemniscus starts with an M. So mesencephalic nucleus that starts with an M. So my face can feel. It can feel proprioception to mesencephalic nucleus. It can feel touch sensation to the main sensory nucleus. Or it can feel pain and temperature to the spinal nucleus of trigeminal. Then what? All of these fibers will converge together and give me a thick bundle that will go upstairs. What's the name of this bundle? A lemniscus. That belongs to whom? To the trigeminal nerve. Hence, trigeminal lemniscus. And you said you're going upstairs to whom? Well, all of the sensations have to lay into the thalamus. So the trigeminal lemniscus is going to the thalamus. How many lemnisci do I need to know about? 4. You need to know about trigeminal lemniscus and spinal lemniscus, medial lemniscus and lateral lemniscus. So medial, lateral, spinal, and trigeminal. Hey medicosis, what is the textbook definition of a lemniscus? A lemniscus is a band of ascending fibers going up. These fibers have to be sensory fibers. Where? In the brainstem. And what is the brainstem? Midbrain, pons, and medulla. Therefore, does the olfactory nerve have a lemniscus? Well, the olfactory nerve hits the forebrain, not the brainstem. That's why the olfactory nerve has no lemniscus. How about the optic nerve? It hits the diencephalon in the forebrain, not brainstem. And that's why the optic nerve does not have a lemniscus, something that your competent professor will never tell you. Your professor is as competent as the mitral valve of a patient with dilated cardiomyopathy, not very. So, if you want to make sure that you understood this, bring a piece of paper and let's doodle together. Here's the midbrain with the 4 balls behind, superior colliculi and inferior colliculi. That's the midbrain. Followed by Mr. Pons, okie dokie, then followed by the medulla oblongata, and then followed by the spinal cord, beautimus. How many nuclei does the trigeminal nerve have? The answer is 4. Let's start with the easy one, which is the main motor nucleus, or simply motor trigeminal nucleus. Okay, this will give us the motor root of the trigeminal nerve, which will only join forces with V3, which is the mandibular nerve, in order to supply 8 muscles. 4 muscles of mastication and 4 muscles of no mastication. 4 muscles of mastication include masseter temporalis, medial pterygoid, lateral pterygoid. 4 muscles of no mastication include tensor palati, tensor tympani, mylohyoid, and anterior belly of digastric. Then I have the principal sensory or main sensory nucleus of trigeminal nerve, also in the pons, and this is responsible for what? Touch sensation from my face. So it gives fibers to V1 and V2 and V3. But what if I'm feeling pain and temperature from my face? Fear not, my friend, because we have the spinal nucleus of trigeminal nerve, or simply spinal trigeminal nucleus. But what if I'm feeling proprioception, the position of joints in space and stretch and stuff like that? You have the mesencephalic nucleus, which extends to the mesencephalon or the midbrain. So the 4 nuclei of the trigeminal nerve are mesencephalic in the midbrain, main sensory and motor in the pons, spinal trigeminal in the medulla and spinal cord. Mesencephalic for proprioception sensation in my face, spinal trigeminal for pain and temperature sensation from my face, main sensory, get your touchy feather off my face, and motor trigeminal nucleus for 8 muscles, which will only give fibers to mandibular nerve. See what happens when you doodle with medicosis? Bring another sheet of paper and let's go to town. Okie dokie, here is the pons, where the trigeminal nerve emerges. After the trigeminal nerve, we have a big trigeminal ganglion like this, which will give us V1, followed by V2, and then V3, ophthalmic, maxillary, and mandibular. The ophthalmic nerve will delve into the cavernous sinus, okie dokie, and what else? You know V2 will also delve into the same cavernous sinus. Which part of the cavernous sinus plays? The lateral wall. So here is V1, here is V2. Don't forget that above V1, we have the oculomotor and the trochlear nerves. So here is cranial nerve 3, cranial nerve 4, and V1 and V2 from 5. How about V3? It does not enter into the cavernous sinus. Then what? After they emerge victoriously from the cavernous sinus, V1 will enter into the superior orbital fissure, and because V1 is the smallest branch of the three, it is kind of embarrassed and will say something important. Leave me, the French toast, alone. Leave me, lacrimal, the French toast, frontal nerve, alone, nasociliary nerve. And don't forget that the lacrimal is lateral. Since V1 is purely sensory, the lacrimal, frontal, and nasociliary nerves are purely sensory. But for the sophisticated among you, this lacrimal branch will take some fibers from the pterygopalatine or sphenopalatine ganglion, which contains what? Parasympathetic fibers. Where the flip did they come from? From the seventh cranial nerve. Oh, so the facial is contributing some of its parasympathetic fibers to give it to the lacrimal nerve so that the facial's parasympathetic can supply the lacrimal gland, so that you can give me your precious crocodile tears. What does the lacrimal nerve supply besides the lacrimal gland? It has a palpebral branch for your eyelid. The frontal will divide into supraorbital and supratrochlear. How about the nasociliary? Infratrochlear, oh yeah, and infraorbital. Shut up. Infraorbital will come from the maxillary. That's another story. So infratrochlear and anterior ethmoidal. Those are the terminal branches, but the nasociliary will also give me posterior ethmoidal and two long ciliary nerves, which are sensory, and they do have some sympathetic fibers. Because remember, if you are long postganglionic, you are sympathetic. But if you are short postganglionic, you are parasympathetic. So therefore, the short ciliary nerves are parasympathetic, but the long ciliary nerves are sympathetic, with some sensory, of course. So that's it for the ophthalmic nerve. As for the maxillary nerve, it exits the cranial cavity via the foramen rotundum. Oh, rounded foramen? Exactly. How do I remember this? V2 is called the maxillary nerve. Think of a guy named Max who walks by the rotunda. After leaving the cranial cavity through the foramen rotundum, it will continue as is and will change its name from maxillary into infraorbital. And that's why I told you that nasociliary will give me infratrochlear, but not infraorbital, because the infraorbital will be part of the maxillary nerve. Before it became infraorbital, however, it gave me a zygomatic nerve. The zygomatic nerve will divide into two famous branches, zygomatico-temporal and zygomatico-facial. Now let's talk about the continuation of the maxillary nerve, known as the infraorbital nerve. Why do I call it infraorbital? Because it's beneath your orbit. And then it divides into three terminal branches. We have palpebral branch, nasal branch, and labial branch. To supply the lower eyelid, who supplied the upper eyelid then? V1, baby. Nasal for your nose and labial for your upper lip, because remember that V2 is for the upper jaw. Maxillary from maxilla. Then we're going to talk about the mandibular for mandible or lower jaw. It exits the cranial cavity via an oval foramen known as foramen ovale. Then as it exits, it divides into an anterior division and a posterior division. Collectively, they have sensory fibers such as the lingual nerve to my tongue and the inferior alveolar nerve, which enters into the mandibular foramen, which is the famous foramen in your mandible. So that's why it's the nerve of the lower jaw. Does V3 have any more sensory fibers? Yes, indeed. It has the famous auriculotemporal nerve, like this, which starts by two different roots. You know who's gonna be found between those roots of the auriculotemporal nerve? This is your famous middle meningeal artery. If you hit my side of my skull and rupture my middle meningeal artery, you know what's going to happen? I will suffer from an epidural hematoma, talk and die syndrome. Why do you call this nerve auriculotemporal? Because it's near your auricle, which is the ear pinna, and near the temple, i.e. temporal bone. So these are the sensory fibers of V3. We talked about the lingual, we talked about the inferior alveolar, and we talked about the auriculotemporal. How about the motor branches? Oh, remember the 8 muscles, baby. 4 muscles of mastication and 4 muscles of no mastication. The 4 muscles of mastication are masseter, temporalis, medial pterygoid, lateral pterygoid. As the 4 muscles of no mastication, we have 2 tensors and 2 others. The 2 tensors are tensor veli palatini, tensor tympani, mylohyoid, and anterior belly of digastric. If the anterior belly of digastric is supplied by the mandibular nerve, then who supplies the posterior belly of digastric? Please comment below. Are you ready? Let's talk about the trigeminal nerve. I started from the 4 famous nuclei in the brainstem. Trigeminal nerve, then trigeminal ganglion. The trigeminal ganglion is related to the superior petrosal sinus, which is a vein, and the internal carotid, which is an artery. This is called what? The sensory root of trigeminal. All of this is sensation. Where's the motor root of trigeminal? This is the motor root of trigeminal. The sensory root of trigeminal came from 3 different nuclei: mesencephalic, main sensory, and spinal trigeminal. As for the motor root of trigeminal, it came only from one nucleus, which is the motor nucleus. Then V1 and V2 will enter into the lateral wall of the cavernous sinus. V1 will enter into the superior orbital fissure, and because it's the smallest branch of all 3, it is embarrassed, and it will say, "Leave me the fudge alone." Leave, lacrimal, fudge, frontal, and alone, nasociliary. The lacrimal will supply the lacrimal gland after borrowing some parasympathetic fibers from the facial nerve via the pterygopalatine ganglion. It will also give me a palpebral branch for the skin of my upper eyelid. Then we have the frontal nerve, supraorbital and supratrochlear, and the nasociliary nerve, infratrochlear. Do not say infraorbital because that's for the maxillary. So infratrochlear and anterior ethmoidal, as well as posterior ethmoidal, and 2 long ciliary nerves, which have sensory functions and sympathetic functions. V2 does not enter into the superior orbital fissure. Instead, it leaves the cranial cavity via the foramen rotundum. Then it will give a zygomatic nerve, which enters into the infraorbital fissure and then divides into zygomaticotemporal and zygomaticofacial. The zygomaticotemporal will reach the lacrimal nerve to give it more parasympathetic fibers that it got from the pterygopalatine ganglion. Infraorbital nerve is the continuation of the maxillary nerve. It, too, is related to the pterygopalatine ganglion. It supplies the upper jaw, superior alveolar nerves, not to be confused with inferior alveolar nerves. So superior alveolar nerves, V2, inferior alveolar nerve, V3. And then this continuation of the maxillary nerve will give us palpebral, nasal, and labial branches. Last, the mandibular nerve. It exits via the foramen ovale. Recall that the motor root of trigeminal is related to the internal carotid artery in its foramen lacerum. Lacerum because it's lacerated and irregular. After exiting from this beautiful foramen ovale, the V3 mandibular nerve divides into anterior division and posterior division. The anterior division will give us buccal nerve and will supply the masseter, the temporalis, and the lateral pterygoid. How about the medial pterygoid? The nerve to medial pterygoid came from V3 before it divided into anterior and posterior. Don't forget the rest of them. Tensor palati and tensor tympani, also supplied by nerve to medial pterygoid. Then we have a nerve to mylohyoid, which supplies the mylohyoid muscle and the anterior belly of the digastric muscle. We shall not forget the lingual nerve for the tongue, inferior alveolar nerve, which enters into the mandibular foramen for the lower jaw. Don't forget that the lingual nerve, which is sensory, is gonna borrow some parasympathetic fibers from the submandibular ganglion via the chorda tympani of the facial nerve. So, you see here the lacrimal nerve borrowed some parasympathetic fibers from facial, in which ganglion pterygopalatine plays. Moreover, the lingual nerve borrowed more parasympathetic fibers from the facial. Which part of the facial? Chorda tympani nerve. And which ganglion this time? Submandibular ganglion and not the pterygopalatine ganglion. I cannot end this video without mentioning the famous auriculotemporal nerve, which starts by 2 roots that surround the middle meningeal artery. Around the middle meningeal artery, we have some sympathetic fibers making a plexus, so the auriculotemporal will borrow some sympathetic fibers from the fibers around the MMA. It will also borrow some parasympathetic fibers from the otic ganglion. Why do you call it otic? Because it's near my ear. Hence, parotid, near the ear. Para-otid, para-otic, parallel to the ear. And the auriculotemporal nerve, because auricle means ear. In a nutshell, cranial nerve 5, trigeminal, receives sensation from the face and supplies innervation to 8 muscles. You can download these doozy handwritten notes on my website medicosisperfectionalis.com. Let's take it to the clinic. We'll talk about trigeminal nerve palsy and herpes zoster ophthalmicus. Please keep this one in mind because later when we talk about the facial nerve, I will tell you about herpes zoster oticus. Ophthalmicus in my eye, oticus in my ear. Here are the 3 branches of the trigeminal nerve. So if I have problem in the ophthalmic branch, what's going to happen? I will lose sensation over this area, including the tip of the nose and the upper eyelid. If I lose my maxillary, I will lose sensation from this area, which is over the lower eyelid and the maxilla, or the upper jaw. If I injure my mandibular, what's going to happen? I will lose sensation to this part of the face, lower jaw. I'll also lose my motor supply to the 8 muscles, including the muscles of mastication, so I'll be unable to chew my cud, my food. But even if I lost the entire trigeminal nerve, I will still keep the sensation over the parotid gland through the great auricular nerve. The next disease that we'll talk about is herpes zoster ophthalmicus. Suppose that I had chickenpox during my childhood. I got the active infection called chickenpox, varicella, with generalized rash all over my body that is vesicular. A vesicle is an elevation of the skin that is filled with fluid. If it's filled with pus, it's called the pustule. If it's not squishy, and if it was solid instead, we call this a nodule. Then, just like most viral infections, it is self-limiting, so it disappeared. But it was not eliminated. Instead, the stinking varicella zoster virus became dormant in my ganglia. It loves the ganglia, such as the trigeminal ganglia. Later in life, a few years later, if my immunity weakens or if I get so old, now it's easy for the virus to proliferate again, reactivate. And it was dormant in the trigeminal ganglia, so we'll keep inching forwards until it affects the branches of the trigeminal nerve, such as V1, the ophthalmic nerve. If you want to be an excellent doctor, listen to this. If your patient started having the vesicles of varicella zoster or shingles on the tip of the nose, it means that a few moments later, the patient can develop herpes zoster ophthalmicus in his eyes. So you better be proactive and give a cyclovir because we can say bye-bye eye. And that's why anatomy is so important, which explains why most doctors that we have today are complete doofuses. When was the last time you saw a doctor who said, oh, careful, there is a rash on the nose, I gotta protect the eye? Only excellent doctors do this. The doofus ones will give you a cream for your nose and give you a kiss on the forehead, which is ironically the distribution of the ophthalmic nerve. If you did not pay attention, boom, before you know it, the herpes is in the eye, and I have the triad of herpes zoster ophthalmicus, unilateral vesicular rash, including the tip of the nose and the upper eyelid. Why unilateral? Because usually the virus reactivates in one ganglion, and you have 2 trigeminal ganglia. And then what? Well, shingles is always painful, so eye pain. Shingles in my eye, I get what? What's the first layer of the eye? The cornea. I get keratitis and blurry vision. Blurry vision that is painful and accompanied by vesicular rash equals herpes zoster ophthalmicus. And to prove to you that this hit the ophthalmic nerve, touch the cornea. The patient will not feel it and will not blink because the corneal reflex is now gone, because V1 is now gone. She gone, man. She gone. So let's be proactive, people. And here's a question for the next video. What's the name of the nucleus that receives taste sensation from your tongue? Let me know your answer in the comments. Do you want to learn about ophthalmological surgery, trauma surgery, orthopedic surgery, neurosurgery, cardiothoracic surgery, and much more? Download my surgery high yields course at medicosisperfectionalis.com. To learn about angina, myocardial infarction, ischemic stroke, hemorrhagic stroke, ARDS, drowning, many toxicology topics, download my emergency medicine high yields course at medicosisperfectionalis.com. And if you want to understand pharmacology, especially antibiotics, I have a course for this as well, and many other pharmacology courses on my website medicosisperfectionalis.com. There are more than 300 videos on this channel available to you when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.